Hi everybody, it's Rob here from Total Care Physio. I'm a chartered physiotherapist in the Limerick Clinic. I know everyone's really concerned about the numbers in COVID at the moment, but I just wanted to share with you, we have had no COVID cases at all in clinic since any of this started, and I just wanted to share how we've managed to do that, because it's really simple. If there's a couple of rules that you follow, it's very, very straightforward to do. So I suppose what spreads COVID-19, we know that it's caused by respiratory droplets. So that's when you cough or sneeze, or if you sing out loud, that's how it gets transferred and passed. And the three kind of rules for us in clinic when we're here are basically hand hygiene, wearing our masks, and then wearing our PPE gear. Once we get those three things right, it's safe, in essence. So here's how we manage to do it. So first thing is we try and cut down any unnecessary contacts. So basically what that means is when patients are trying to come into us into our clinic, we've closed our reception area, so you don't have to wait or mingle unnecessarily. We call you and you can come straight in to have your appointment. It also means that we've cut down on any unnecessary paperwork. So instead of giving out appointment cards, we give out text reminders. Instead of printing your receipt, we email your receipt. And instead of printing off your handouts and your programs the old-fashioned way, we send them as videos, basically. Then as a team, we do all our meetings through Zoom, basically. We've gotten really adept at doing it. And then it means during the day, we have lunch by ourselves. So we have a small little area where we sit and we do it basically by ourselves. So we're not having any risk of transferring anything onto anybody. So that's basically the first big step of what we do. The second thing then is that before anybody comes into the clinic, they have to pass our COVID screening questions. So these are the usual questions that everyone knows at this stage. The second thing is we give everybody a little zap with our thermometer. Their temperature has to be below 38 degrees. And we've actually a great set of patients. In the 10 months since COVID has been here, nobody has failed a temperature check, which is amazing, really. People are really, really diligent and really, really careful. And the last thing, everyone has to use hand sanitizer or wash their hands when they come into clinic. That's for us, that's for our patients. And we find that by doing that, nobody has come in with any problems. The next thing that we do when we're in clinic is we wear our PPE gear. The idea behind this is to try and protect you. So I'm going to get Sarah, my colleague, to jump in for a moment so you can see what it looks like. So basically it's a face mask, and the idea of the face mask is that this covers 99% of the viral load. The face shield is extra protection, and the gown and the scrubs and gloves are extra protection on top of that. So looks a little bit intimidating, but it's all for your safety, basically. Lovely. Thank you, Sarah. The next thing that we do that's really important then is we try and cut down on any unnecessary contacts in terms of treatments. So if you need to come into us, you can absolutely come in. But if you need to stay at home, or if you need to isolate or cocoon, we do face-to-face video consultations online through our sessions, so you can get your treatment that way. The next step then is cleaning. So when I start my working day, I'll come in, I'll disinfect my workstation and my work area. After every single patient, I'll take my medical grade wipes and I'll wipe down my contact surfaces again. And then at the end of my shift, I'll go through the same process. So between the lot of us, we probably do between 50 and 70 cleans on any one average day in clinic, basically. And then the last thing that we do is we make sure that any of our instrumentation that we use, we make sure it's clean and it's autoclaved. So in the sense of podiatry and chiropody, our instrumentation gets cleaned thoroughly. First of all, it gets popped into an autoclave, which heats it to a very, very high temperature, keeps it at that and kills everything. And then it's stored in these single-use bags, basically. And that's it. That's how we have managed to keep COVID at bay. It means when you come into us, you're safe. So if you've gotten any tips or anything from that, please feel free to share and like this. And thank you. Talk to you again soon.